Welcome to the deep dive. Today, we're zeroing in on something that might sound a bit specific, but actually has some really big impacts. Porcine rectal stricture.
Yeah, it's essentially a severe narrowing, sometimes a complete blockage of the rectum in pigs.
And why are we diving deep into this? Well, it might seem niche, but it's a surprisingly significant cause of sickness, death, and real economic loss in the swine industry.
Absolutely. And understanding it gives us, a fascinating look into how disease works, how the body tries to heal, sometimes with unintended consequences.
So our mission today is really to give you a clear path through the information. We've gone through quite a bit of material reviews looking at the causes, diagnosis, treatment, prevention, all that.
We're aiming to pull out the crucial bits, the insights you need to know, and maybe some surprising facts along the way. Consider this your shortcut to getting well informed on this condition.
Okay, let's start with the basics then. What exactly is porcine rectal stricture?
So fundamentally, it's an acquired condition, meaning pigs aren't born with it, and it's often fatal. It's characterized by this ring of scar tissue forming inside the very end of the rectum.
Like scar tissue constricting things.
Exactly. It tightens progressively like a drawstring, leading to this, well, irreversible obstruction of the gut.
So it's not really the primary disease, but more like a severe after effect.
Precisely. It's a sequela, a consequence, and typically you don't even see the clinical signs until about 2 to 4 weeks after whatever initially caused the damage.
And the immediate result for the pig, I imagine it's quite noticeable.
Oh, definitely. The blockage prevents feces from passing, so you get this massive accumulation of gas and fecal material upstream in the colon and cecum.
Which leads to that classic sign people might recognize.
Yeah, the severely distended, bloated abdomen, that characteristic pot-bellied or sometimes called pneumonia-up look. But it's important to remember this comes with intense pain for the animal.
Right, it's not just a visual thing. There's pain, and you mentioned other effects too.
Yes. Alongside the distension, there's rapid weight loss, emaciation, even with the swollen belly and toxemia, basically poisons building up in the system. It all points to a uniformly poor prognosis, unfortunately.
That sounds incredibly rough for the animal. So how does this actually happen? What's the mechanism behind it?
The general process, the pathogenesis, starts with some kind of damage to the rectal lining, the mucosa.
Damage from what, though?
Could be a few things. A physical injury like rectal prolapse, a severe infection, or even sometimes trauma from handling. This initial damage triggers inflammation and ulceration.
Okay, standard response to injury.
Right. But here's the critical step. During the healing phase, the body sometimes goes overboard producing fibrous scar tissue. This scar tissue then contracts as it matures, and that's what narrows the rectal opening, forming the stricture.
So the body's repair mechanism kind of backfires.
Exactly. It creates this blockage that prevents feces passing, leading to all the problems we just discussed.
And you mentioned rectum prolapse. The sources point to that as the most common trigger, right?
Mm.
Yes, that's the one most people recognize. The prolapse itself is traumatic. It causes damage, starts that whole inflammatory cascade.
But here's a really interesting part I saw. This stricture can happen even if the prolapse seems to, fix itself, or even after treatment.
That's a crucial, often overlooked point.
Mm.
Say you have an untreated prolapse in group housing. Sometimes pen mates bite it off or it just becomes necrotic. The tissue dies from lack of blood supply and it sloughs off.
So the pig might seem okay afterwards.
It might survive that initial event, yeah.
Yeah.
But the remaining rectal stump heals, and it heals by forming a fibrous ring. That ring contracts over time.
That's the stricture.
That's the stricture. There was one study, it was pretty eye-opening, found that 21%, about 1 in 5 pigs that appeared to recover naturally from a prolapse, later developed a complete fatal stricture.
Wow, 21%. That's significant. It's like a hidden complication waiting to happen.
Exactly. And it's not just the untreated cases. Stricture is a known significant risk after treatment, too.
Even when trying to fix a prolapse. Well, think about the common treatments. Surgical amputation of the prolapse tissue, using devices like prolapse rings, or even just manually pushing it back in and putting in a purse string suture to hold it.
Right.
If that suture is tied too tight, for instance, it can cut off the blood supply, cause ischemic damage. That leads to tissue death, scarring, and potentially a stricture later on. Any intervention carries some risk if not done perfectly or if the initial damage was severe.
That makes a lot of sense. The repair itself can lead to scarring. Okay, but then the sources also mention this moment, strictures forming without any prolapse. How does that work?
Right. This was a really key finding. In these situations, the underlying issue is usually a severe localized inflammation of the rectum itself. We call it proctitis.
Inflammation.
Mhm.
Caused by what?
The big player here seems to be infection, specifically with Salmonella enterica, particularly the Typhimurium serotype. This bug is known to cause a really nasty ulcerative proctitis.
So the salmonella directly attacks the rectal wall.
It does, but here's the fascinating part connecting it to strictures. The severe inflammation it causes can actually lead to blood clots thrombosis forming in the very small arteries that supply blood to the rectal wall.
Cutting off the blood supply.
Precisely. And the very end of the rectum has kind of a vulnerable blood supply anyway, especially in a zone about, say, 2 to 5 centimeters up from the anus.
So that specific area is prone to damage if blood flow is cut.
Extremely prone to ischemic injury damage from lack of oxygen. When these infection-induced clots block those tiny arteries, that tissue dies. And when it heals, you guessed it heals with that characteristic tight, ring-like scar, the stricture.
So that explains how you can get a whole outbreak of strictures in a group of pigs after they've had a bout of salmonellosis, even if none of them actually prolapse.
Exactly. The damage is internal, vascular, triggered by the infection. It's often an invisible wound initially.
Are there other bugs involved or maybe other factors besides salmonella?
Well, Salmonella typhimurium is definitely the one most frequently implicated, but other bacteria that can cause issues with small blood vessels, things like Erysipelotheryx reuseopathiae, Haemophilus parasuus, maybe some Streptococcus species, they've also been potentially linked.
Okay.
And then you have factors that make the Salmonella infection worse. Immunosuppressive viruses like porcine circovirus type 2, PCV2, can make pigs more susceptible to severe salmonellosis, which then indirectly increases the risk of this kind of stricture.
So it's a complex picture. And you mentioned trauma from handling earlier.
Yeah, less common, but rough handling during rectal exams could theoretically cause enough damage. And there are very rare cases of congenital abnormalities, but almost all cases are acquired, like we said.
Got it. So given how serious this is, how would a farmer or a vet actually spot it in a pig? What are they looking for?
The pigs affected are almost always in the grower-finisher stage, so older than piglets but not yet adults. The number one sign is that progressive, really severe abdominal distension.
The blown-up pig again.
That's the hallmark. But what's really striking, and maybe counterintuitive, is that while their belly is huge, the rest of their body is wasting away. They become emaciated, gaunt, their hair coat often looks rough.
Bloated but starving, essentially.
Yeah.
What about, going to the bathroom?
Defecation changes, definitely. Early on, if the stricture is only partial, they might strain a lot, pass maybe soft, thin, ribbon-like feces. Or sometimes they might have projectile watery diarrhea trying to get past the blockage.
But eventually.
Eventually, as it becomes complete, they just stop defecating altogether. And you'll see general signs of being unwell, they're dull, depressed, they stop eating, and sometimes their skin might get a yellowish tint, which is jaundice from toxins backing up.
Okay, so those are the signs. How do you confirm it's actually a stricture?
Often, a simple digital rectal exam can give you a definitive diagnosis, or at least a very strong suspicion. You put on a glove, and when you insert a finger, you'll feel a tight, firm, unyielding ring, or narrowing, usually about that 2 to 5 centimeter mark inside.
You can literally feel the blockage.
Yeah, you can. And if the pig unfortunately dies or has to be euthanized, a necropsy, the post-mortem exam, provides clear confirmation.
What do you see then?
You'll see a massively swollen spiral colon and cecum, just packed with gas and semi-liquid feces. The walls of the intestine might be really thin and fragile from being stretched. And then you'll find the stricture itself a very distinct, firm, white band of fibrous scar tissue circling the inside of the rectum.
Okay, so we've got the signs, the diagnosis, which brings us to the really tough part. What about treatment? For a pig on a commercial farm with a complete stricture, what can be done?
This is the hard truth. For commercial swine, there's really no effective or, frankly, economically viable treatment for a complete rectal stricture.
Not at all.
Pretty much none. The prognosis is considered uniformly grave. Because of the suffering involved and the lack of viable treatment, humane euthanasia is almost always the necessary course of action for welfare reasons.
And these affected pigs wouldn't be suitable for market anyway.
No, absolutely not. They'd be condemned at slaughter, considered unfit for human consumption.
Why don't things like, say, trying to manually stretch it open or surgery work?
Well, attempting to manually dilate or stretch the stricture is almost never successful long term. It provides maybe temporary relief, if any, and carries a huge risk of actually rupturing the rectum, which would be fatal.
Okay, so that's out. What about surgery?
Surgery, like cutting out the scarred section and rejoining the ends, or creating an artificial opening like a colostomy, technically it's possible, but in the context of commercial pig production, it's just not practical. It's expensive, labor-intensive.
And not guaranteed to work.
Exactly. Even if you did the surgery, recurrence of the stricture is a known complication, so it's just not a cost-effective or reliable solution in that setting.
So the bottom line is, if a pig develops a full stricture, there's really nothing practical to do for it.
That's the reality. Which means,
Prevention is everything.
absolutely. Since treatment isn't an option, all the effort has to go into preventing the things that cause it in the first place.
Which brings us back to the two main pathways, rectal prolapse and severe gut infections, especially salmonellosis.
Correct. So preventing rectal prolapse is key. This means tackling underlying diseases like respiratory infections that cause chronic coughing or other gut problems causing diarrhea and straining. Constant straining puts pressure on the rectum.
Makes sense. What about feed and environment?
Nutrition is huge. You need adequate fiber in the diet to keep things moving smoothly, avoid sudden major diet changes, and definitely have good mycotoxin control because some molds in feed can mess with gut health.
And the pig's living conditions.
Environmentally, you want to avoid things that cause stress or straining. Prevent cold stress so pigs don't pile on top of each other, avoid overcrowding, make sure flooring isn't slippery. Basically, manage the environment to minimize physical stressors.
And if a prolapse does happen despite best efforts,
Then prompt and proper management is crucial. Either treat it quickly and correctly if the tissue is still healthy, or make the decision for humane euthanasia early on, specifically to prevent the suffering and the potential for a stricture developing later if it heals poorly.
okay, that covers the prolapse side. What about preventing the strictures linked to salmonella and that ischemic damage?
There, the focus shifts to controlling severe enteric disease, primarily salmonellosis. That means really good biosecurity, sanitation, and swift action if you see diarrhea outbreaks.
Quick diagnosis and treatment of the diarrhea.
Yes, aggressive treatment to limit how severe the rectal inflammation gets. If a farm starts seeing more strictures than usual, they really need to investigate underlying infections, especially looking for salmonella.
Would medication ever play a role preventatively?
In some situations, yes. If a herd has known recurring problems with salmonellosis during certain periods, strategic use of antimicrobials, always guided by a veterinarian, might be considered to try and head off that severe proctitis before it leads to strictures.
So it really sounds like preventing strictures boils down to excellent overall herd health management.
It really does. Careful handling during any procedures, balanced diets to prevent constipation. It's all part of the picture. By focusing on these upstream factors controlling disease, managing nutrition and environment producers can significantly cut down the chances of this really nasty, costly, and ultimately fatal downstream problem.
This whole discussion really highlights how something like a physical prolapse and something totally different like a specific bacterial infection causing blood clots, how they can end up in the same terrible place.
It's a stark reminder, isn't it? It really shows how interconnected things are in physiology.
And I think understanding a condition like this, porcine rectal stricture, it goes beyond just pig health, wouldn't you say?
Yeah.
It sort of shines a light on that delicate balance in biological systems.
Absolutely. It underscores the critical importance of prevention, especially when treatments are limited or non-existent. And it also highlights the tough economic and animal welfare decisions that are just part of modern animal agriculture.
So maybe a final thought for our listeners to chew on. What does the really grim outlook for a pig with rectal stricture tell us about those complex links between things like stress, infectious bugs, and the body's own healing response, which sometimes, as we've seen, can go wrong?
Yeah, and maybe how those same kinds of interactions, environment, pathogen, host response, play out in other complex systems, whether it's maintaining health in other livestock or even thinking about challenges in, say, human public health.
It's definitely food for thought. How understanding one specific, maybe even obscure-sounding problem can actually give you insights into much broader principles of health and disease.